Good evening, all the participants. Sorry for the delay. Um, we have just waited for some of the participants. Okay. Good evening, all. I'm Dr. Sheetal Kulkarni from Oasis Care Ayurveda. Our center is since 2014, and we are here in Karama, Dubai. And we are working here since 2014. Since then, this is the one of the most biggest center in UAE, and I'm proud to say that we are one of the authentic therapy centers in Ayurveda. Normally, we are doing Keraliya Panchakarma therapies here with the wellness and the treatments part from Ayurveda. Now, first, we can start with our sessions today. The session today is for the cervical spondylosis, and I won't take you much of your timing, and we'll start the session now. Okay. If you have any kind of questions, please post it on the chat box, or you can unmute yourself and ask it after the session. Thank you. Yeah. Now, the today's session topic is, although it is a cervical spondylosis, but we have kept it as say goodbye to the neck pain. Okay, so let's start. What is cervical spondylosis? Actually, now this term we all know, it's very normal nowadays. Every one of us knows that if any kind of a pain related to neck, then we can tell it as we have a cervical spondylosis. But is it so? Is it that a simple term? But no. It's a specific kind of a arthritis which attacks the vertebra and connects to the connected bones and the ligamental structure, and it is known as spondylosis. But what happened actually in cervical spondylosis, we can see in this, as in the picture you can see, normally it start normally with the neck, but not only the neck, it will be neck vertebrae. Even the internal structure is also get affected. You can see in this picture, today's topic, we are just going through normal detailing of the cervical spondylosis, what it is and how it affects to our body. What are the changes affecting to the cervical spondylosis? What are the symptoms? And how Ayurveda is going to help in cervical spondylosis. So for the first slides, you may think that very much detail or anything is not there. Actually, we are keeping this Q&A session for the normal people, and who can know the cervical, what is cervical spondylosis, and if they are going through this kind of a pain, they can approach us immediately like that. Okay, so in this slide, you can see that this is a picture, and this is our vertebral column. Okay, so it is considered as a degenerative kind of condition of a cervical spine. Degeneration happened when we get older. Okay, but nowadays, in nowadays era, in 30s, even in 20s also, we can see that these kind of problems are very much occurring, and due to our busy lifestyle and the sedentary lifestyle, you can say continuous sitting jobs and the desktop works, and many of the kind of the causes are also, we are looking at further also, we will see it. That is the main cause of cervical spondylosis. See, if you can see this is the normal vertebra. Vertebra is our vertebral column. There are some slices you can see. In this is a normal vertebrae, and this is the abnormal vertebrae. And these are the changes happen in cervical spondylosis. Now, what are the major changes happen? You can see in this picture, if you can able to see that. Yeah, I can see properly now. See, this is the erect position of our spine. Now, because of our sitting position and continuous bending down for the work or for the mobile phone, now our spine is getting like this kind of a curve on it, you can see. Okay. And afterwards, if you are not preventing it, then it is going to be like this for the third picture. Okay. So the bones in this and the cartilage in this are gradually developed a wear and tear within the age, and all because not, if it is not age, then all because of our lifestyle, too much of a weight on the vertebral column, and because of many reasons, we can see it afterwards, the changes are happened in this vertebral column. Okay. First cause is the work related activity. There's those who are carrying too much of a load on their head. The one who can physically, the labor persons, or who can carry too much of a load on their head, can be the main victims for these kind of a thing. Or the people who can, normally nowadays you can say that many of us are the only, not only the workers who are taking the load, but some people who can carry their bag, laptop bags, or a heavy shoulder bags, or any kind of a bag related heavy shoulder thing. If you can carrying and in a continuous order, you can develop that kind of a spondylosis even. So what happened in this? Dehydration of the disc, as we saw that the vertebrae was there. In that vertebrae, there are many types are there inside. There is a sponge. I'm not going too much of in a technical terms, but in that some kind of a fluid is also there. So if it is drying up, the disc is drying up, or any kind of a bony spur, any protrusion is there, the too much of excessive pressure is there on the vertebrae, then it will cause. Or it is called as a herniated disc. You can see down, there is a vertebral column, which is a normal one. And because of too much of a pressure and the compression, the disc in between is compressing in between. And because of that, the herniation disc happened. With advanced age and the nucleus loss of the fluid, and because of the loss of flexibility, this can happen. As a result, complete structure get dehydrated, and which makes the disc more susceptible and damage. This is not a thing which is in one day it will happen. The continuously, if the same thing we are doing it, and if you are not preventing it, this will happen. Even the herniated disc can be seen. Okay. Now, what are the more things? One thing is the neck injury. Neck injury is not because of any kind of a fall or any kind of a accident. Yes, it is due to that also one of our reason. But now, because of the main cause is our cell phones. Continuously, without even we can't even make out that we are looking at continuous thing. But yes, as the picture shows that as we are continuously leaning towards the phone, this is kind of an injury we are doing for our neck. Okay. Hope I am audible to all of you. Anyone can unmute themselves and just tell me. I'm thinking that I'm only the one who is speaking. If it is, I'm audible, hopefully.
Yes, you are audible.
Thank you so much. Okay. Then the other factors which are triggering is, as I told you, that the poor postures. As we are now very much of a sedentary lifestyle, normally when people are sitting in the office, if the chair is not proper, if their desk is not proper, if the height of a person and the desk and their laptop or a computer is not in a proper distance, then also these kind of a spondylosis changes can be trigger some thing. And because of that, even sometimes people are tend to look to they are so addictive to their phones that they are sitting in the continuous in one position. And because of that also these things can happen. People may think that no, I'm just looking at my phone, what is the thing in that? But yes, this can be a main causative factor. Okay. And last one, which may be very much new to every one of you, will be excessive intake of dry and sour food. Now, which other dry food we are normally eating? These are the namkeens, are very much favorite chips, and which the foods which are highly and quickly available in the shops, which are packed in a nice pack, which are the dry foods and the sour foods, which are not really good for our bones and the bone structure. We will talk about it later on also. Moving to the next slide, what are the symptoms? Okay, how you can understand that I have a spondylosis or I need to see a doctor for this. Especially, first symptoms may be a little kind of a pain. You can see a little kind of a stiffness will be there. I can't able to move my neck here and there, or you may ignore that symptom sometimes. But is it so that is it necessary to see a doctor, and what time I should see a doctor, you can ask then. Especially the tingling sensation is there in the hands or in the neck, or the tingling sensation is coming towards your shoulders and it's going down to your hand. If any times your fingers are feeling numb because of the neck pain, if you're feeling the weakness in your arms, you can't able to grab any object, you can't able to perform your daily activities, and this nagging pain is constantly there in your neck is stiff always, you can't do the regular movements from your neck, then yes, you need to see a doctor. And lack of coordination in your actions, if it is there, and if the pain is triggering down to more down to your vertebral column, if it is difficulty for the walking also, and if it's tremendous muscle spasm during any time of the day, especially in the mornings, then you need to see the doctor. Now, our main thing is, as you, many of the people nowadays are so much aware that cervical spondylosis is not a new thing to everyone. All of us are now a Google doctor, and all of this, whatever I told you, must be many of them aware about it. But as an Ayurveda physician, this is the topic we need to see, that as per Ayurveda, what is cervical spondylosis, and what Ayurveda says about it. As per Ayurveda, we are not calling it as a cervical spondylosis, but it's a group of many diseases are together coming in cervical spondylosis. And yes, it's resembled in Charaka Samhita, it is told that it is resembled like a Griva Stamba, and it is called as a Vata Vyadhi. Okay. Then what are the different kind of Ayurvedic terminologies for cervical spondylosis as a differential diagnosis, we can say. Sometimes it is mimic as a manyastamba, that is neck spasm, you can say. Even sometimes it's griva stambha, which is shoulder stiffness, or one of a big kind of term is there, it's called as a vishwachi. It is a term in which the tingling sensation, there is a numbness is too much over there, can't able to do the activity properly. The term vishwachi or the Vyadhi Vishwachi is there. One type of a big Vyadhi is called in Ayurveda as Apabahuka. In that, the shoulder restriction movements are there. So, what are the positive factors as per Ayurveda is concerned is there? We look at it that if any person or any Rugna is having too much of a food which is increasing kind of a Vata, we can see in this. Vata increasing food, which are, as I told you, the dry food, the sour food, which are too much of a spicy food, or the food which is creating gastric issues, these kind of a food. Or nowadays, because of the frozen food and the too much of a preservatives kind of a food, which is increasing these kind of symptoms, we can tell it as a causative factor. Sometimes prolonged period of fasting is one of a kind of a main causative factor. Even this may be a topic of discussion, as the nowadays the intermittent fasting and many kind of a different kind of a diets are there. Maybe people will ask that how it is possible and all. But yes, it is a very much documented thing that too much of a fasting, we see it as everyone is not same. Many people have their appetite and metabolism which are different. But in some cases, yes, too much of a prolonged period of a fasting may deplete the nourishment and increase the vata, and due to that, these kind of things will happen. Too much of an intake of a food, untimely, you can say. Normally, as we see that our older generation used to say that you should eat the food very on time, right? And nowadays, because of our fast lifestyle, we can't able to make it like. Today I skipped the breakfast because I got up late because I have a meeting today, so I skipped the lunch. Many of a time this thing happened, but what will happen if we are doing it in a regular basis? That is going to affect on our health. Okay, so because of the one reason or a cause will be untimely intake of food, then junk food or the sodas or even the less intake of water, liquids, and too much of a spicy food may be a causative factor for the spondylosis. Now we can see what are the causative factors in the viharaja, means what type of environment or in what are the environmental factor which are the causative factors for this. One is night awakening, means too much of a ratri jagarana, we can say. Some people nowadays, it's a fashion, or for a young generation or a teenagers, they may think that it's very cool to be awake at night, but too much of a ratri jagarana is the one of a causative factor for the cervical spondylosis, or you can say a vata vyadhi kind of a causative factor. A day sleep, if anyone is sleeping or anyone is having a habit of day sleep, we call it in our terminology, it is divasvapa. It is a causative factor of, for many disease. So even heavy exercises, people who are in the gym, going for the gym, and even who are have a habit of doing too much of exercises are also a causative factors for these kind of a disease. Now, the main thing, which is suppression of urges. Natural urges are the urges, means many urges are there, which is sneezing, farting, even sleeping, even food intake and everything, drinking water. Are these are, if they are getting suppresses, these are the causative factors. Weight bearing on the head and shoulders. Walking for a long distance, means too much of a distance if anyone is walking. Bike riding and a long distance, too much of a bike riding, maybe a continuous if they are doing it, may be the causative factor for the vata vyadhi. Now we can say what Ayurveda is thinking for this kind of spondylotic diseases and how Ayurveda see towards it. We call it as a what Ayurvedic physicians are looking at it. What are our perspective? If anyone is coming here for a kind of a neck pain or any kind of a frozen shoulder or any kind of a pain related to hand and neck thing, normally if they are telling us that I have a cervical issue and this is my X-ray reports and these are my MRIs and all. Although it is all things are there, but still we are going to see the Vyadhi Parikshana is very much important for each one of the patients. What are the doshic state of them? What type of a doshas their prakriti is, and what type of the symptoms are there. As per that, we used to diagnose the patient properly. Sometimes one type of a thing, it is amavata, which is sometimes mimic as, or some people tell it as rheumatoid arthritis, but it's not like similar. It is very much different than rheumatoid arthritis, but the symptoms may mimic like that. So sometimes cervical spondylotic changes are will be amavatika janya. Sometimes it is a vata rakta kind of a things also can be seen in this type. So rakta involvement, vata and rakta involvement also will be there. In our terminology, there are some sroto rodha kind of thing. If it is there, we need to see in this. I don't want to go for too much of a technical terms, but yes, we are looking it as a what are the difference we can see in the cervical spondylotic types. Then Asti Majjagata Vata is also one of the type, and some Avarana Janya Chikitsa will be also there. Yes. Then what type of treatments we are giving in this? In Ayurvedic treatments, normally we see it what type of stage people are going to come to us. What type means if it is an early stage, if it is a too much of a stiffness only is there, or if it started very recently, if it is acute stage, or how chronic it is. As per that, we are assessing the patient properly. We call it as a Sannipatajanya Santarpanajanya Chikitsa or Patarpanajanya Chikitsa, how it is, and looking after the patient's symptom only, then only we can plan the treatment accordingly. If it is a Dhatu Kshayajanya Chikitsa, then the Chikitsa is totally, the treatment will be different. And if it is a Sroto Rodhajanya Chikitsa, or if it is a too much of ama is there accumulated, then the treatment plan will be totally different. Aggravated, as per the aggravated doshas also we are doing it. The plan of treatment will be, first of all, the Deepana Pachana, and then the Snehapana, and Svedana Chikitsa, and then the Panchakarma Chikitsa will be also there. So for each of the person, if you can say, it's not a tailor-made one, only one kind of a chikitsa is there, or one kind of a treatment only is there for everyone. As per the symptoms and the stage, the treatment may differ. Okay. Now we can see some kind of a pictures which are maybe interesting to you, and what are these pictures and what are the correlations in the cervical spondylosis, I can say. Now this is called as a Griva Vasti. This is one of the treatments we do it in cervical spondylosis. In this chikitsa, there are typical, this is kind of a bruhana kind of a chikitsa. We are not doing it in a previous very first stages, but yes, this is the main kind of a chikitsa in this kind of a thing. There are a circular formation formed before, and in that we are keeping the oil. There are many oils which are different as per the doshic dominance. It is called as a Griva Vasti, Gala Vasti also. Now this is one of the chikitsa. It is called as Podi Kizi. Kizi is a potali. We can see that in this, the potli, there is the powder is mixed, and it is a dry kind of a dry fermentation will be there, or sometimes as per the patient condition, we are changing the inside powder and the herbal powder. And if it is for the Amavatajanya Chikitsa, then we are doing it in a dry form, and other form we can dip it in the oil and do the massages. This is called as an Aringa Kiri or a Patrapinda Sweda. In this, freshly squeezed herbs are there, and as per the patients, we are changing it, and the therapists are properly trained, and they are doing it. This is Nasya treatment, and you may ask that why Nasya treatment is necessary for the spondylotic changes. In Ayurveda, this type of a panchakarma is told for the detoxification of any kind of urdhva jatrugata vyadhi. And yes, cervical spondylosis is the urdhva jatrugata vyadhi, and Nasya is a very good result-oriented treatment in this. And this is Shirodhara. It's good treatment for the nerve calmness, and even for the cervical issues. This is Spirinchil. It is called, even called as Tailadhara. It is a very rejuvenating kind of a treatment for spondylosis. If anyone is having any kind of questions, you can ask in between. Sorry for this. Okay. Yeah. There are some kind of other panchakarmas are also there. Internal medications, if with the treatment we are following some internal kind of medications also, which are good for the treatment. And with the internal medication, some panchakarma and some kind of treatments are going on. And with this, different kind of diets as per the patient's age, their stages we are recommending. And then after the treatment, some kind of a rasayana chikitsa is also recommended. And then afterwards, some yoga abhyasa, which is they should do it in a proper instructed way. We are telling them to do it. Okay, if anyone is having any kind of a questions, they may ask now, as we declared it as a Q&A question actually session. It is a good chance for you everyone to ask the questions, as I'm not going too much in a detail for this cervical spondylosis. As everyone, we know that there are two sessions of this. This is the first session. In that we went through just a primary line of a cervical spondylosis treatment, and what is cervical spondylosis and what are the symptoms, and what are how Ayurvedic's perspective is there for looking at cervical spondylosis. We are going every month now. We are going for a different disease, a variety of diseases for the Zoom sessions now, and it will be a good session for all of you for Ayurvedic perspective of a disease. Yeah, there is one question. Is painful neck hump caused by spondylosis? Yes, actually, painful neck hump actually is the main cause of spondylosis, as the posture is very much different. For neck hump, we can see that that hump is not came suddenly. Slowly it is coming, and it is, yes, it's all because of the spondylotic changes, or it is all because of your postural habits and the way you are sitting. It's all because of that, or sometimes, yes, because of the obesity will be the main causative factor for. Okay. If anyone is having any other questions, they can ask. Even they can unmute themselves and ask, no problem. Thank you, Gitanjali. Yes, usually how many days treatment is required for the patient? Mr. Joshi, I can say that as per the patient's symptoms and the stage, in which stage they are coming to us, it's very much important for us to tell the patient that how much days treatment is required. If the patient is coming to us in a very acute kind of a phase, then they may require a very less number of a treatment. Sometimes, as I told you, that in treatments also we are finding it as what kind of a stage or what kind of a srotorodhajanya, if they are having too much of a amavatajanya or any kind of a different kind of a vyadhis are already there in the spondylotic changes, then yes, for the panchakarmas and all, they may require more number of a treatment. But yes, it is very much required to see the patient in physically. Then only we can decide the days of treatment. We have to work for 8 to 10 hours on desk job. What advice do you give to avoid back pain and other related disease? Okay, so Nora, I can, you may be even knowing it, and you need to get up from your desk at least after every 15 to 20 minutes and take a walk so that you can just stretch your muscles. That will be one form of a viharaja kind of treatment, you can say. Even in between, you need to change your positions. Your desk should be on a proper distance, your chair should be good, and your distance from the laptop or a computer should be proper. Just check it first. And if the pain is still there, then just you can come to us anytime. You can take a consultation for that. If it is not aggravated, you can go for Ayurveda, Abhyanga, and any kind of a podikiri and any kind of a good massages that will helpful. Yeah, hope this is the answer for your question. Yeah. Okay. Does any patient need to take all the treatments like Shirodhara or Nasya? No, not necessary. As I told that Shirodhara and Nasya treatment or any other treatments which are given in the PowerPoint presentation are not for everyone. As I just show you these kind of treatments, as I just for a pictorial presentation I have shown you, but not everyone is required Shirodhara, even not everyone is required Nasyam. Nasyam and Shirodhara mainly required for the patients who are in a complicated stage of any kind of a spondylotic changes, like anyone is having myopathy or anyone is having too much of a neck nervine dysfunctions and all that type, that treatments are needed. How long it take to cure neck pain? Mr. Varghese, I can say that for this reason, you need to see a doctor, and I need to check what stage your pain is and how much acute or chronic it is, and as per that, we can see that how much treatment you are required. How can I recover from my cervical spondylosis fast? You can see us anytime, sir, and we can very much happy to help you. What about surgical options available in allopathy? We have to go to surgical option at any stage? For this, sir, Sia, I can tell you that there are many surgical options available in allopathy, but we need to see that you need to check second opinions of the different alternative therapies also. I'm not telling that we are only the best, but yes, we are one of the best. You can come to us anytime. We can check you properly if how much aggravated your symptoms are there, and accordingly we can suggest you the proper treatment. And yes, if it is not in our hand, or if it is too much of a chronic, then only you can go for the surgeries. But yes, Ayurveda has a marvelous good effects for the cervical spondylosis, and we are giving very fantastic results for our patients. So you can see us anytime. Welcome. Does Oasis have any special arrangement for spondylosic patients? Yes, sir. More number of patients here we are getting nowadays for these kind of work-related issues, and many arrangements means many of the therapists are well trained. We have DHA-approved therapists here, and very trained therapists which are ready to help you out in this. Is insurance cover? Yes, ma'am. Many of the insurance which are having the alternative therapies in it are covered in our facility. Can exercise improve spondylosis? Exercises in the term of it's like a debatable question. Actually, spondylosis happened because of lack of exercises and lack of movement, you can say. But yes, if you are doing it when the pain is too much, then it's better not to do in that stage. As you are improving the condition, then your doctor will suggest you at what condition and what stage you need to start the exercise. So it's better to speak to your doctor, and then only can do the exercise. As we are even telling our patients when sometimes they are coming here for therapies, and suddenly when they feel very much good and they start running and they start their yoga and they start their workouts, normally the pain again starts. So normally we are telling our patients not to do any kind of extravagant exercises during the sessions. So yes, so this is the answer for your question. Yeah. So any one of you, if you have any kind of a question, anytime you can call us and take an appointment of our clinic. And on the screen, you can see our clinic address and the WhatsApp number. Anytime you can call us and come. You're welcome for the treatments. And our center is open from morning 9 to evening 9. And we are open for 7 days a week. And it's a very convenient location in Karama. So it's very much convenient for the person who are coming by car or metro or bus. Anyway, that's very much convenient. Yeah. Yeah. Hope everything is clear. If anything is there, then you can anytime call us. Thank you. Thank you, sir. Okay. So I think we can wind up the session now. And thank you for